Welcome to Midlife Matters, where we celebrate women's wisdom and wit. I'm Georgian Lussier, your host, and I'm delighted to introduce today's guest, a rock star in the healthcare industry, affectionately known as Maria P. Maria brings over 40 years of experience and contributions in many different areas of healthcare, and she's here to share her story with us. What I'd really like to start with is your current passion, which is the program at the New Britain High School for helping to direct people into the healthcare field. So how did that all get started?
The New Britain Academy for Health Professions is a smaller learning community at New Britain High School. And it was conceived by the business community in New Britain. In 2008, the superintendent of schools asked the business community to identify what are the graduation requirements for students upon completing high school so that they could become employed. And through the Chamber of Commerce, a survey was sent out to all the businesses, and it turned out that the healthcare sector was the largest growing employment sector. And therefore, they wanted to create a program of study at the high school to introduce students to the healthcare industry. A meeting was held at Mayor's office where the superintendent of schools and the CEOs of the two hospitals in New Britain. There were two hospitals there, Hospital for Special Care and the Hospital of Central Connecticut. They are the anchor hospitals of the healthcare system in New Britain. And through discussion, it was identified that they really wanted to do this program. And so the seed was planted. They began what is now a model academy for not only for New Britain, but for Connecticut as well. There were other high schools coming to visit the health academy and to model the curriculum. And I was asked if I could help him start the program. And this was November 2009, and here I am 5 years later, and I can't seem to disconnect. I work with the most amazing science teachers who really are passionate about their work and inspire the students every day to come to school, engage them in meaningful work, and really get them excited about the healthcare system. Today it has 305 students enrolled in 4 grades in 16 courses. None of us knew what we were doing, but our collective talents came together, and through partnerships with the district and the 2 hospitals, we now have an amazing academy. It really brings all my skills together as a healthcare professional, and I couldn't be doing anything better than this at this stage of my life, as I am a retired healthcare executive.
And I saw a wonderful article about the program. It was interesting because I saw that some of the students came to observe and immerse themselves a little bit in the actual environment, such things as observing the aquatic rehab area, the sports programs, wheelchair sports, the role plays, actually sitting in a wheelchair themselves. I mean, it looked like there was a variety of opportunities for the students to really gain different perspectives and speak to staff members.
We have what we call Discover Our Hospital Day, where sophomores come to the hospital one day, interact with a variety of professionals, especially our rehab team. Most people think that when you get sick, you go to the hospital for an operations or to have a baby, or if you're sick, you go to the emergency room. So they come to our hospital to explore that this is a different kind of a hospital. It's a hospital that offers programs and services to patients who have long-term needs. And so they learn the rehab process. There are 4 primary team members: physical therapy, occupational therapy, speech-language pathology, and therapeutic recreation. They get to explore these disciplines as well as some of the other non-clinical areas, because the one thing that we would like for students to know is they do not have to be a doctor or a nurse to work in healthcare or to work in a hospital. That there are over 250 opportunities in a hospital setting that they can explore. And not all of them have to be with patients, because not everyone is comfortable working directly with patients. However, we are finding that students at the Health Academy do want to work with patients, especially the elderly and pediatrics.
And I think the fact that you're an integral part of that is a wonderful part of your story.
As I said, it's really been the best thing I could have done at this stage of my life. Who knew?
It just evolved.
It just evolved.
It just evolved, and you were there to answer the call.